Hi, and welcome everyone. This is Julie Morin. I'm the Chief Business Development Officer for Bale Donin Practice. And we are so excited to have Dr. Joel Kahn join us. And I just wanted to make sure that Joel and I are able to connect with each other right here. We've got still quite a few people that'll be joining us here in the next minute or two. Can you hear me, Joel? See if we, oh, there we go.
Aha! Thank you thank you for unmuting, or as they say in the cow business, unmuting me. Thank you.
Of course, absolutely. Well, I wanted to make sure that I did a nice introduction for you and wanted to give everybody a chance to get logged on. We've got people joining us right now. And so anyway, I just wanted to welcome everyone to the Bale Donin webinar series. The Bale Donin method offers optimal personalized medical care to prevent heart attacks, strokes, and type 2 diabetes based on the latest science. Doctors Brad Bale and Amy Donin wrote Beat the Heart Attack Gene and offer training programs for medical professionals around the world. Their goal is to eradicate heart disease as the #1 killer by 2020. And we're starting this series of webinars featuring some of Bale Donin graduates and partners in health. So thank you, Joel Kahn. He's a cardiologist. He uses a plant-based diet plan to advance his personal mission to prevent 1 million heart attacks over the next 2 years. Joel is a graduate of the Bale Donin method and endorses our method for heart attack, stroke, and prevention. The Bale Donin method, we get many questions on how to integrate nutrition with disease prevention to help patients live a healthier life. Dr. Kahn is a great example of how this is working in a clinical practice. Dr. Kahn's brand of cardiology combines the best of Western and complementary therapies for total healing. He is known as America's holistic heart doc and graduated summa cum laude from University of Michigan, Ann Arbor. Here at Bale Donin Method, we are going to be having guest speakers talk on subjects of interest to the community and are excited to have Joel as our inaugural speaker. Thank you for joining the Bale Donin Method and Dr. Kahn for this webinar on how nutrition is such an important piece of how medicine is moving forward with heart attack prevention. We will open the floor for questions when Dr. Kahn is finished with his presentation. So I will turn it over to you, Dr. Kahn, and we look forward to what you have to tell us today.
Well, thank you very much, and I'm truly both honored and excited to kick off, an expanding world of Bale and Donin, because a very intrepid dentist in Detroit and periodontal specialist Douglas Thompson, who has attended many, many Bale and Donin meetings, has been pulling on my coat strings for a while. You got to hear, and I'd been through a lot of both standard and functional medicine, cardiology, integrated medicine, cardiology training, but Brad and Amy have really synthesized such an excellent way. And in fact, I'll say this just unprepared. I have the dubious honor of owning the largest health restaurant in the Detroit area. And I just left there about 45 minutes ago, 30 minutes ago, to make this talk. And a very well-known dentist was in a restaurant for the first time. And all I was telling him was, you got to go to Bale and Donin. And in fact, just a moment ago, I just emailed him the website, said you need to sign up for the course, because I'm that enthusiastic about the quality of training, both for MDs, DDSs, DMDs, and abbreviations I don't even know. So yeah, really very grateful to do this. And I don't want to belabor everybody's busy on a afternoon or evening. But very briefly, as I was introduced by Julie, I am a 26-year veteran of standard cardiology, but not even standard. I mean, I graduated #1. I went to academic programs. I published 150 peer-reviewed papers. I wrote book chapters. I've written 3 books. And I was introduced to nutrition not in medical school because unfortunately 26 years later, or I guess from my medical school training, about 33 years later, there's just about as much nutrition training in medical school now as there was 33 years ago when I graduated Ann Arbor. But I was introduced the first day of undergraduate studies, 1977. I walked into my dorm, I walked into the cafeteria, I looked around, not as a particularly picky eater, and I said, I'm a vegetarian because everything looks dead but the salad bar. And I actually was introduced to nutrition via that kind of impulsive decision that every time I'm at the dorm, I'm eating vegetarian. And it unfolded over time. I got more interested in this topic of the potential role of the choice of eating patterns in medicine and health. And when others were reading about HIV in the early 1980s, I was reading about chickpeas and lentils and HIV. And had just kind of followed that path in my own personal life, now being a long-time plant-based slash vegan human, animal rights activist. I am a professor at Wayne State University, the largest school of medicine in the United States, and I also picket and protest Wayne State University because of some of their animal experimentation. I've been involved in kind of the environmental concerns. I'm not a tree hugger. I'm just worried about my grandchildren and what kind of world they're going to live in. And I'm not old. I don't have grandchildren, but I'm worried about them anyways. So we're going to kick this off and stick to good scientific material, but I've incorporated first into a traditional practice of fee-for-service, and for the past 10 months a cash-based, semi-concierge, but different model of cardiology practice in suburban Detroit, a heart disease reversal clinic where I apply the Bale-Donine method and nutrition and a couple other little asterisks that we can talk about later. But it's all under the EdFrog model. It's totally education, disease, fire, root cause, optimal assessment, and then genetics and such. I do exactly that process, and I've refined it because of Amy and Brad. So moving forward, let me see. There we go. So here is the enemy. The intense process of cellular proliferation, calcification, cholesterol crystals, collagen scar material, crazy stuff that over the process of years occludes our arteries progressively till plaque rupture occurs and we have a sudden thrombosis, or there's an imbalance of supply and demand and patients experience angina or breathlessness, or they have sudden death, whatever the outcome is of this terrible process. And you can both appreciate in the upper picture the cellular debris, the inflammation, the fire that Brad and Amy so stress. Sorry, Amy. Brad and Amy so stress in terms of evaluation. I'm a completely committed, and I have no financial ties to say this, Cleveland Heart Lab cardiologist. I love getting multiple parameters of inflammation and trying to evaluate why and then drive them down to normal. You can see the degree in the upper picture of cellular proliferation, and on the bottom level more kind of collagen scar and probably cholesterol crystals just waiting to poke through the cap and cause a erosion or ulcer and then thrombosis. So it would be absolutely insane, I believe, to look at these pictures and say, I can reverse that by changing people's diet. I can alter their stress level. I can change their activity level. I can reverse this process. I mean, anybody doing that would have to be half-cocked. But indeed, thank goodness, in the world of nutrition, there are such people who have the bravery and the insight, and I'll tell you some of those stories as we proceed to do that. Another picture without the cellular staining of an occlusive and progressive plaque, in this case not yet ruptured, not yet eroded. But the idea that you could turn the clock back and reverse such a complex process of, again, what Dr. William Roberts, when I trained with him in Dallas, said pultaceous debris and calcification and cellular infiltration and scar and cholesterol would be really, kind of insane. One of the fundamental breakthroughs in terms of just approaching this disease, root cause, the R of EdFrog, was data that was first presented in 1993, then updated every few years, when the United States publishes the cause of the leading causes of death in the United States. And it's easy to say heart disease, cancer, and stroke. What's harder is to get to the root cause. And if you look on the right in the orange, 85% of the deaths in the United States due to chronic disease, heart attack, cancer, and stroke, is due to lifestyle. It's due to tobacco, poor diet, and physical inactivity. And poor diet is generally described as a lack of fruits, vegetables, and fiber. That's the standard definition in a lot of these studies. So whether you smoke, whether you eat enough fruits, vegetables, and fiber, and whether you walk 30 to 40 minutes a day or not, is actually the root cause of the #1 causes of death in the United States. So we should rename them tobacco excess, poor diet, or vegetable and fruit deficiency, fiber deficiency, and then inactivity and sedentary lifestyle. Those really are the root causes. And therefore, it suggests to somebody forward thinking, what if we stop smoking, we improve our diet, we improve our activity, and although it's not on here, managing stress, which is maybe the root cause of indeed why we smoke, why we eat poorly, why we don't exercise, and such. So we'll look forward. So can you look within the traditional medical model for the answers to these lifestyle-related root causes of atherosclerotic coronary artery disease? So you may recognize the conundrum in this photograph. I'm proud to say now historical medical people, because until about 4 months ago, this was the McDonald's in the lobby of the Cleveland Clinic Foundation, by far the #1 rated and busiest cardiovascular program in the United States, if not the world, probably the world. And after 20 years of being first invited in and then embarrassed by a McDonald's in their lobby, they finally broke the contract and exited the owner of this McDonald's, probably with a pretty nice settlement. But so traditional medicine, my own university hospital that I'm on staff at in Detroit, Harper University Hospital, has a Wendy's in the lobby. So can you really look to traditional medical sources for nutritional counseling when half of the patients and their families are eating at Wendy's in a university hospital affiliated with the largest medical school in America? And I'm being a bit brash, but I've taken on this mission of speaking about via social media and such, that hospitals need to be the leaders, not the followers, in this mission. So the slide that I've just put up is a fascinating medical experiment, and whether I'm speaking to 5th graders, as I do sometimes, or clinical faculty at Wayne State University School of Medicine, if I'm talking about nutrition, I showed this study. So just to set it up, Dr. Robert Vogel, MD, a fellow of the American College of Cardiology, chief of cardiology at University of Maryland, now semi-retired in Denver, and one of my professors in Ann Arbor, that's a long sentence, did this study in the 1990s. He used brachial ultrasound and measures of endothelial function of the brachial artery and took healthy volunteers on 2 different days. One day he fed them a low-fat breakfast full of whole grains. He looked at their endothelial function over 7 hours, and he concluded whole grains low in fat do not cause endothelial dysfunction. Hallelujah for that. That's basically a bowl of oatmeal. But then he did literally take in these healthy volunteers on a separate day, a yellow bag with a sausage egg McMuffin straight from the McDonald's down the street from University of Maryland Hospital. Fortunately, it wasn't in the lobby of the hospital, but it is in about 20 hospitals still in the United States. And he fed these healthy volunteers. And as you can see, the red line within an hour, 2, 3, and then the nadir being at 4 hours, there's severe endothelial dysfunction that develops within an hour of eating a sausage egg McMuffin, peaks at 4 hours, takes a full 7 hours to recover. Processed food rich in salt, sugar, oils, full of antibiotics, pesticides, herbicides, and chemical colorings and such, causes endothelial dysfunction. And it should be a wake-up call that it's not just food is medicine in 10 years if you eat a processed food-laden diet, like 60% of American calories, but actually within just a very short time frame. What frightens me is to this day, my cardiology fellows at one of the largest cardiology programs in the United States Beaumont Hospital, Royal Oak, I'll call them out, feeds fellows sausage egg McMuffins in the doctor's dining room, and then they go do complex coronary procedures with endothelial dysfunction probably happening in their own vessels. Very disturbing. And I don't want to sound too radical, but if the medical community doesn't lead this mission, who's going to lead this mission? So just to further this very provocative slide, further studies confirmed this finding and showed that within minutes of eating such a highly processed food as a sausage egg McMuffin, there is release of endotoxin into the bloodstream. Before you get time for this food to passage all the way down to the colon and affect the microbiome, there is actually in the highly processed meat of most fast food restaurants dead bacteria with still active endotoxin lipopolysaccharide bacterial shells, and the endotoxin can be released in the blood quickly and cause endothelial dysfunction. So there's literally a toxin in these kind of foods that is in our bloodstream within minutes and causing endothelial dysfunction within minutes to an hour. So scary wake-up call. So there again, if the FDA really was monitoring the health of the United States, perhaps they'd take Ronald away and put him away. But let's move on to medicine. So what is an optimal cardiac nutrition for prevention and reversal? I'm not going to go with traditional medical therapy like ACE inhibitors, pioglitazone, statins, niacin, and such, wonderful therapies that I use as appropriate and as aimed at nutrition and what does the science speak to. So you can go back actually to early in the medical literature, that this is 1960s. I just want to point out, this medical history, just read this for a minute. This is a 65-year-old man who has severe angina at 9 or 10 paces. As you can see, the very high upper left corner. This is published in the American Heart Journal, a pretty good peer-reviewed cardiology journal in 1977. He elected in 1964 to start a vegan diet, felt much better within 5 days. If you can affect your endothelium and cause dysfunction in an hour, there's no reason not to anticipate you might cause endothelial function within 5 days. And a month after starting this change in diet, elimination of animal products and processed foods and added oils, he's having no angina now on fairly strenuous activity, and he actually, and amazingly, 7 months later is climbing mountains. So this is in the peer-reviewed literature, along with some other case studies. I don't have a slide, but I just want to bring up the name of Nathan Pritikin. Nathan Pritikin was an engineer who in the 1950s was diagnosed with angina. In his early 40s, cholesterol over 300, diet that was horrible. He did his own research as an engineer and said, I can beat this, and changed his diet to a largely plant-based diet, low in added oils, avoided all animal products, and within a few months he was free of angina. He did have a markedly positive stress test. He never underwent catheterization. He ultimately got so interested in this, he wrote a book, The Pritikin Method, that became The Pritikin Edge. It was another one, became a New York Times bestseller, and actually established first in Santa Monica, and then now in South Beach, and still available, the Pritikin Longevity Center. And ultimately, they accumulated so much data on a largely plant-based diet for the treatment of cardiovascular disease, hyperlipidemia, hypertension, obesity, diabetes, that they actually got in 2010, I'll show you, approval by Medicare for payment. Your patient who's in the Medicare age range, who's having angina and has established cardiovascular disease, can, by prescription, ultimately spend a week in South Beach at an elegant center of disease reversal and have some or all of it paid for because the data was so compelling after years of research. So that's what kicked this off, started his vegan diet, then he was climbing mountains. Not bad. But we have to pass the baton from the engineer, Nathan Pritikin, to the visionary, Dr. Dean Ornish. And every year, U.S. News and World Report ranks diets. The #1 most healthy diet in America the last few years has been the DASH diet, the dietary approach to stop hypertension. But when they rank the heart healthy diets, it is the Ornish diet, after the physician in Sausalito, California, Dr. Dean Ornish, who has taken the award year after year after year. It's a bit ironic that the picture is a piece of salmon and lettuce, because actually salmon is not part of the diet that Dr. Ornish designed. So as a very young medical student, Dr. Ornish, actually as an undergraduate when he was at Rice University in Houston, having grown up in Dallas, Dr. Ornish spent a year in India. A very famous guru advised him, Guru Sachidananda, that the experience in India was that plant-based nutrition was very helpful, spices were very helpful. And the young medical student, soon to be internal medicine resident, Dean Ornish, in the 1970s, came back to University of California, San Francisco after Harvard Medical School, and he designed a trial with this food pyramid: vegetables, fruits, beans, legumes, whole grains, non-fat products, non-fat dairy products, very limited, with less than 10% fat calories overall, with many of the traditional, what might be called nowadays, healthy fats restricted or eliminated. And he asked his colleagues, give me your worst cardiovascular patients, those that are having angina, positive stress test, cath-proven coronary disease, unable to have primitive angioplasty. We're talking late 1970s, early 1980s, right when balloon angioplasty was starting. People that were not suitable for bypass surgery, let me try and treat them with a dietary approach. But indeed, the approach extended a bit beyond diet. It was actually lifestyle from the beginning based on his experience in India. It was not smoking, it was walking, it was stress management via meditation. He first presented an abstract at a medical meeting in the late 70s. The Journal of the American Medical Association, obviously a very fine peer-reviewed journal, published his preliminary data, fairly impressive, 23 patients in a randomized group that in the experimental group were kept in a hotel for 24 days and fed the experimental diet of a 99% plant-based diet. The only non-plant-based would be egg whites and some non-fat dairy like non-fat yogurt. And the other group was allowed to continue on. These people were having active angina, positive stress tests, documented coronary disease. And within just 3 weeks and 3 days, they increased their exercise duration by 44%. That may not seem like much, but if you know of the FDA-approved drug Renexa, which I'm not slamming because I use it and it's a good drug, this is far beyond the increase you see with Renexa, a drug that is generally considered quite expensive and takes longer than this for a result. Cholesterol dropped within 3 weeks and 3 days, and most remarkable was the 91% drop in frequency of angina, leading to the conclusion that a change in lifestyle, predominantly in diet, but also walking and stress management, seems to benefit patients with advanced ischemic heart disease with many symptoms and documented coronary disease. Fairly amazing results. Of course, what's lacking here is catheterization data, stress test data. Is this a placebo effect? These people were in a hotel for 3 weeks and 3 days being fed beautiful food, just happened to be different than the average American diet with 60% processed calories. These were whole food, plant-based stir fries and salads and casseroles and bean dishes and such, but without added oil. So things were made with vegetable stock and wine and water and such. So was it a very powerful placebo? Could endothelium repair within 24 days to allow a 91% decrease in angina? Could a thrombotic potential and platelet aggregation decrease and such? So he took a fair amount of criticism, and being the dogged person that he was, he put together a more advanced randomized study, now including cardiac catheterization. He was able to bring on board Dr. Dean Ornish, now a little bit older, but still probably before he was 30 years old, bring on some of the country's leaders in cardiac imaging, angiography and such. He was a non-invasive guy, so he had to depend, but he brought on some of the top people in the United States, designed this program with ideally 0% of calories from added fats, very low in cholesterol because there's no animal products other than egg whites and non-fat dairy. Refined carbohydrates. He identified early on you can't take away fat and add processed sugar. You can't take away fat and add white flour. This had to be take away added fats and add in whole foods like beans and greens and whole grains and such. And he was in favor of adding soy based on Japanese data that's quite extensive. The cardiovascular disease in Japan has been low. Some of you know of vitamin K2 and one of the and its data that it may help prevent coronary calcification. And much of the sources of vitamin K2 is in soy, and particularly fermented soy like natto. And he developed this study, not a large study, very difficult study. But what was unique was there was a baseline cardiac catheterization. The catheterization was analyzed by a technique that's not talked about much, but remains the most accurate way to analyze a heart catheterization, called quantitative coronary angiography, where a computer decided if something was 20, 40, or 60% blocked. And they repeated the study at baseline 1 year and 5 years. That was what these subjects signed up for. Plus, they were followed clinically, plus blood tests and such with frequent follow-up. And as you can see here, control versus the Ornish diet, stress management, walking program. Cholesterol plummeted severely. There were no statins in this trial. It's been highly recognized. How can a plant-based diet work when HDL drops like this? Of course, there were no measurements of HDL functionality. There were no measurements of myeloperoxidase, which may be a marker of HDL at the time. Yeah, when you looked at disease progression at 1 year, far less frequent in the diet group than the control group. When you looked at regression, can you actually regress years, if not decades, of established atherosclerotic coronary disease? You can, much more frequent. And when you looked at the overall mean change at 1 year, the control group worsened and the experimental group improved in terms of percent stenosis. As you may know, when you look at fluid dynamics down a pipe, it's to the fourth order of the radius. So even a very small improvement in the radius can translate to a very large increase in blood flow, let alone endothelial function, let alone platelet aggregation, explaining perhaps the 91% decrease in angina, which was seen in this trial, not just that preliminary trial published in 1983. Dr. Ornish took his group of researchers. I'll just point out that one of these researchers was Dr. K. Lance Gould. He was the leading nuclear and catheterization analyzer in the world. Dr. William Armstrong was at the time the leading echocardiographer in the world. Dr. Thomas Ports, one of the leading cath lab people in the world, and such. These were all colleagues of mine at the time this study was published. And he followed these patients. This is the 5-year data, not the 1-year data. And again, they found, strangely, but differently, that this group also had a 91% reduction in angina, just like the preliminary trial published in 1983. And then if you look at this, these are heart events, cardiac events, experimental group, control group. Myocardial infarction fell by half. Yes, it's small numbers. Need for PTCA fell by about half. Need for bypass fell by about half. Cardiac hospitalization fell by about half. Deaths 2 and 1, not much power there. Any event fell by half. So clinical events dropped. What happened after this, and I'll show you one more piece of the data from the study, was Dr. Ornish started talking to the insurers like Medicare and saying, I have a program that can drop events by a half. That's going to save you money. Maybe you want to reimburse patients who go through my lifestyle change program because it's going to save you, the insurer, money. And they said, show us more numbers. So he went on to do that. But this, to me, this graph I'm showing you here, and let me explain it, I believe is one of the most important graphs in preventive cardiology. So on the y-axis is diameter stenosis, not by, and I'm an invasive cardiologist, not by the eyeball, but by quantitative coronary angiography, completely computer-derived, edge detection software, totally objective, not subjective. And if you notice at baseline, both the control group, which was told just do whatever your cardiologist says, and the experimental group that was told eat plants, occasional non-fat dairy yogurt and egg whites, don't add oil to your diet, don't add nuts and seeds. That may seem crazy nowadays. They started with the same degree of average stenosis, but many of them had 80 and 90% blockages. At 1 year, there already was a significant difference. And at 5 years, angiographically, the control group is the black dot. The experimental group is the white square. Much difference in terms of angiographic stenosis with an improvement with nutrition and lifestyle and a worsening with standard cardiology. Along with this was the major difference in clinical outcome and all. So from this data, Dr. Ornish then went on around this time with, again, Dr. K. Lance Gould, the leading nuclear cardiologist or physician in the world at the time, to show not only did symptoms improve, not only did quantitative coronary improve, but actual perfusion of the myocardium. Very small changes in coronary diameter could result in improvements in blood flow. They used PET imaging, positron emission tomography, considered far better than standard thallium or cardiolite imaging. It's quantitative. And they established that there was a dramatic decrease in perfusion defects and severity of perfusion defects using PET imaging. So they had the whole story tied up tight. People felt better, their catheterizations looked better, and their PET scans looked improved. And Dr. Ornish became quite a rock star following this data. Can this man save your heart? The two images at the top are worth reviewing. On the left with the blue streak is a PET scan of the heart. Blue generally reflects poor blood flow. Yellow is medium and red is good blood flow. On the right is the same person without bypass, without stent, without angioplasty. The blue is gone, replaced by good blood flow. This is clear-cut, objective documentation of reversal of hypoperfusion of the heart using only lifestyle, not stents, not bypass. A dramatic change. And then finally, as I mentioned about the engineer Nathan Pritikin, who had the moxie to start up his own program first in Santa Monica and then moved it to South Beach. It remains open and active, and it's a beautiful center. But in 2010, Medicare said, you guys have accumulated so much data, predominantly on cost benefit, because that's what motivates CMS more than clinical outcome. So the Ornish program now had more than 3,000 patient data points over many, many years, and motivated by their cost savings, there is still now the possibility, as I said, there's about 55 Ornish programs that are inside cardiac rehabilitation centers. If you go to ornish.com, you can find if there might be a cardiac rehabilitation center near you that has been approved for sending a physician, a dietitian, a psychologist, and such, an exercise physiologist, to be trained and certified and now run a cardiac rehab program that extends the training to 72 hours of intensive cardiac rehab. And then the Pritikin Center, you'd have to travel to South Beach, which is usually now viewed as too much of a liability. What's absolutely amazing, and I'll just speak about Dr. Ornish for a few more minutes, is I don't know that I do now know him and consider him a friend. I've never had a chance to ask him, why did you get bored with cardiology? He just has a bright mind. But in the early 2000s, starting 20 years after he tackled heart disease, he went to his urologist at University of California, San Francisco, said, give me the guys that you're saying to them, we're just watching your prostate cancer. And he got 93 of them, and he put half of them on his program that was designed for heart disease, and half of them he said, do whatever your urologist says. And if you look at the results, the PSA falls when you eliminate almost all animal products and oils. The PSA goes up in the control group. Fascinating, if you take the blood of somebody in the Ornish program eating a plant-based diet, their blood kills prostate cancer cells 8 times more rapidly than the control group, as if something about the blood of a plant-based human is almost like chemotherapy, and this is without chemotherapy. And then really in one of the seminal studies of epigenetics, if you just take 3 months after switching your diet from standard American diet to plant-based with a little egg white and non-fat dairy, and 98% plant-based, you can determine within just 3 months that genes that fight cancer are upregulated and genes that are associated with the development of prostate cancer are downregulated. And really this whole field of epigenetics is crystallized in this data that you can, with lifestyle, control whether the trigger is pulled or not. And that's the G of EdFrog, the genetics. But the genetics are influenced by environment so heavily, as is shown. The last little piece of Ornish data published about 3 years ago is that if you care about your hair and your wrinkles and aging in general, one of the measures of aging is the length of your telomere. At least that's one of the proposed measures of aging. And in this same prostate study, Dr. Ornish teamed up, if you look at the very bottom, with Dr. Elizabeth Blackburn, professor, PhD at University of California, San Francisco. But she won the Nobel Prize in Medicine in 2009 for her work in describing the activity of the telomerase enzyme. And if you look at the control group, after 5 years, the telomeres were shorter and telomerase activity decreased. And if you look at those prostate cancer patients that adopted the Ornish lifestyle program, social support, stress management, walking, and plant-based nutrition almost exclusively, they actually had a lengthening of the telomeres and an increase in the telomerase activity as if they were causing anti-aging through lifestyle change. So fascinating data, small data, elegantly done by the leading telomere researcher in the world, Elizabeth Blackburn. So pretty convincing data, but is there something funny in San Francisco? Is it unique to California? Unique to California? So very oddly, but around the same time that this young Turk, Dr. Dean Ornish, internal medicine resident, was planning and doing these studies, an endocrine surgeon at the Cleveland Clinic, Dr. Caldwell Esselstyn, he's married to a woman named Ann Kreil. Her grandfather was the founder of the Cleveland Clinic, so they were sort of legacy at the Cleveland Clinic. And he was both a war veteran and a gold medalist. It actually, Caldwell Esselstyn won a gold medal, I think it was in rowing, in the 50s. And he had a very distinguished career at the Cleveland Clinic in endocrine surgery, predominantly thyroid surgery. How in the heck did he end up messed up in this heart disease situation and end up publishing not just peer-reviewed literature, but a very popular book, Dr. Caldwell Esselstyn, Preventive Reverse Heart Disease? Well, he was stimulated, I'll show you in a minute why, to study populations that had no heart disease. He was practicing surgery at the Cleveland Clinic, which was, if you know, the first place in the world to do bypass surgery, the largest center for bypass surgery. And he was just a bright guy, and he was always reading, and he read about these places around the world that were absent known coronary disease. I just show you this. This is from the Cleveland Clinic Foundation website. Some of the heroes of the Cleveland Clinic. The upper left is Dr. Eric Topol. That's right below him is Toby Cosgrove, the current medical director of the entire Cleveland Clinic. Mason Sones is there in the middle, who was the first radiologist to do a heart catheterization. But I want you to see the debonair guy in the lower right with the floral tie. That is Rene Favalero. He was an Argentinian surgeon. And it turns out, because medicine is about serendipity sometimes, Rene Favalero, his name starts with an F. Dr. Caldwell Esselstyn, his name starts with an E. They were redoing the surgical locker room, and for a year, Dr. Esselstyn and Favalero, based on the alphabet, shared a locker, and Dr. Favalero and Dr. Esselstyn would talk a lot. Their gym shoes were next to each other. And Dr. Esselstyn kept asking him questions about heart disease and bypass, and Favalero said, yeah, I bypass, I'm not curing. And out of that came this curiosity to say, maybe we can do in Cleveland what people in primitive populations do with nutrition, and we can cause heart disease to go away. He was stimulated by data like this, which maybe you've never seen, that, for example, in Norway during World War II, Nazis come in, you might think heart disease rates would go up because of stress and other factors. Actually, ischemic heart disease deaths go down significantly, and it's accredited to the fact many people, that the Nazis, one of the first things they did was they took all animal products, being actually live cows, sheep, chicken, pigs, and such, back to Germany to feed the troops. And many people were left foraging in the forest for plant-based nutrition. And as soon as the war ended, and that ended, heart disease rates rocketed back up. Dr. Esselstyn said this really influenced them to propose a study. And he went to the surgeons and said, yes, I'm a thyroid surgeon, but if you have heart patients that aren't suitable, we're talking now about 1985, aren't suitable for bypass or the primitive angioplasty that was being done in 1985, let me at them, because I'm going to give them some primitive nutrition, and I'm going to try and reproduce what happens in native populations. This is the paleo approach, but Dr. Esselstyn's spin on the paleo populations that ate no animal products. So he fed them whole grains, legumes, lentils, vegetables, and fruit. And much like Dr. Esselstyn, he actually ultimately recruited them to come to his home. His wife would cook. Twice a month they'd have social support. A very folksy approach to all this. He said no to added oil, no to fish, fowl, meat, and dairy. He would allow some statins if they couldn't achieve a low LDL cholesterol with diet alone. He tried to strive to a very low percentage fat in the diet, 10%, 11%, much like Okinawa, Japan, one of the blue zones, where 6% of calories are added fats, and they had basically unknown ischemic heart disease. He didn't, I'll just point out, there was no meditation. There was no structured exercise in this program. It was a food program exclusively. And over the course of this study, when he published 12-year follow-up, there were 49 events where people were going to the emergency room days and such before they entered, well, once they entered his dietary program. In probably one of the most reproduced medical photographs ever. This is a general surgeon at the Cleveland Clinic on the left having extensive anginal discomfort, not a candidate for balloon angioplasty because of a distal LAD lesion. He finally agreed to enter Dr. Esselstyn, his colleagues' reversal program. And within a few years, actually within a few weeks, his angina resolved because of endothelial improvement and platelet aggregation returned to normalcy. But on follow-up angiography, he had resolution of a complex atherosclerotic lesion. And another slightly less dramatic but important angiogram on the left, 1987, on the bend. It's a circumflex artery with a moderate but complex lesion, and in follow-up after clinical improvement, essentially normal appearance. Something I can say as a 26-year, or actually if you include my fellowship, 30-year angiographer, you just don't see in routine cardiology. You do not see regression. Dr. Esselstyn may seem like that's a long time ago, but just about 2 years ago, he published a new group of patients he's following, about 200. 89% adhered to his program because partly he's still so involved in his early 80s. You know, call you once a month and find out how you're doing and rant and rave if you've gone back to any regression from his diet. And those that didn't adhere to his program, a small number, seemed to be having clinical events, and those that adhered to his dietary program had essentially none of the clinical events. And this is the publication, and you can see what they ate, and you can see that the majority of people adhered. So the idea that it's too tough depends on who's doing it. If you're having angina, if you're told that you're not a good candidate for bypass or complex stenting, if you're just motivated to avoid bypass, it's a very attractive program based on peer-reviewed data and such. Coronary heart disease is a food-borne illness which need not exist to progress. Provocative, but evidence-based in the data I presented. I'll skip that. I just want to throw this out because the number one question that comes up when you present this to the public and to a medical group is, hey, olive oil is polyphenol rich. It's part of it can activate the sirtuin pathway. Why would we exclude added oils, particularly olive oil? And really that results from, in part, If you remember the Egg McMuffin study that Dr. Robert Vogel did, where he showed that it caused endothelial dysfunction, Dr. Vogel went on to do a similar study with the Mediterranean diet, and he asked a provocative question. Mediterranean diet, low in red meat, high in fish, high in fruits and vegetables, high in olive oil, high in whole grains. He actually separated them, as you can see, the components. He gave people whole grains. They didn't have endothelial impairment. He gave people fish. This was, around 1997, 1998, when maybe there were less pollutants in the world. They didn't have endothelial dysfunction. He gave them fruits and vegetables. They didn't have endothelial dysfunction. He gave volunteers olive oil. They had endothelial dysfunction, a drop in endothelial reactivity, flow-mediated vasodilatation. And that is, only one data point, but there are others that suggest that of the components of the Mediterranean diet, it may not be the oil that is the healthiest of the components. It may be the plant-based, nut-based, and other components. Just briefly to conclude, I just want to present this data. For some of you, you may not know that our government and our tax dollars have been studying the population of Loma Linda, California, where the Adventist Church is centered, and other populations of the Adventist Church around the North American continent, because it was identified in the 1950s that people in Loma Linda, California lived 10 years longer than Los Angeles and the rest of California. Why would this small town of a couple 100,000 live 10 to 12 years longer than the rest of California? The government said, we're curious, let's find out. They did a series of studies that are still ongoing. First with a small number, but now with 100,000 plus participants. And they did questionnaires that started with 4 pages, now 2 pages of online questions. They classified people by diet. The Seventh-day Adventist Church promotes not eating animal products. 8% eat none, so they're classified as vegan. 48% don't care, so they're classified as non-vegetarian. And then there's a mixture of various kinds of vegetarians, and they looked at outcome. If you look at weight, whether you're a non-vegetarian in red, all the way to the complete vegans eating no animal products by food survey in green, bright green, there's the lowest weight is associated with the least animal product intake. If you look at blood cholesterol levels without statin, whites, blacks, female males, the same trend is seen in terms of omnivores versus plant-based versus only plant-based. If you look at blood sugar, it's the same. And to conclude, I don't understand why we ask people to eat a well-balanced vegetarian diet is considered drastic, cutting them open and such is considered not. We're at, if my watch is right, about 45, 50 minutes. I want to leave a few minutes for any questions, if that works. Julie, I'll turn it over to you.
Thank you so much. What a wonderful presentation. And yes, I'd love to open it up for questions. If there's anyone that would like to ask some questions, I'd be happy to see if I can't open it up for that. So let me see. Let me see here just a sec if I can maybe get a little bit of help here to get this opened up. Okay, so I guess that what I'll do is ask you to raise your hand, and I should be able to see your hand on the screen here and be able to open you up for a question. Okay, so I've got some assistance here on this, which is great. Okay, we have a question from Dr. Brad Bale. Hi, Brad.
Oh, hey. No, Joel, that was fantastic. Great job, man. Thanks for launching our webinar series. I really appreciate it. Yeah, you're a world leader and great information in there. So it's a fantastic presentation. I really loved it. I am just curious, do you think the ApoE gene has any bearing at all? Like if somebody's ApoE2, or supposedly they can really handle fat well, say somebody had the 4q25 gene, they're genetically predisposed to atrial fibrillation, they're ApoE2, in that particular patient, would you consider allowing them to have some olive oil? Like, I'm sure you're aware the Mediterranean diet study indicated that can have a huge significant impact on reducing the risk of AFib. So are there some circumstances when you would modify the diet depending on the ApoE gene?
Yeah, that's a brilliant question, Brad. And I got to say, for a guy living in Nashville in Texas, this is a really hard lecture for you to sit through. But I do ApoE testing, and I do kind of rely on it to provide some dietary guidance to patients. I think, I'm not a fanatic. If you have advanced coronary artery disease, symptomatic angina, and little recourse, or you desire not to have bypass or stent therapy, I would advise independent of the ApoE gene, because we don't have ApoE results from Ornish or Esselstyn or Pritikin or Dr. Neil Barnard in Washington, who's done peer-reviewed data on type 2 diabetes and these kind of diets. Dr. John McDougall in Santa Rosa, California, who's published data with both coronary disease and inflammatory syndromes like rheumatoid arthritis. We don't have the data. So if you're in the group clinically that fits these group, but I think that's a very small group. I mean, in the course of a generalist, a preventive clinic like you have, or a cardiologist like I practice, how many people have inoperable, unstentable, symptomatic, or choose to avoid bypass and stenting? I actually think it's great to try and avoid bypass and stenting if you consult carefully with a cardiologist who evaluates the CAF film and stress test to make sure it's not insanely risky. But so we're talking about, is it 5% of the entire cardiovascular patients with atherosclerotic heart disease? Maybe less. For the rest, yeah, I absolutely believe what you said is right. And just to tell you, one of the lone voices out there for about 10 plus years has been Dr. Joel Furman, who has Eat to Live and his nutritarian approach to nutrient-dense foods. He's been advocating, based on studies like the Adventist Health Study, that nuts and seeds shouldn't be avoided, even though in the original Esselstyn and Ornish group they were. And he's been showing good results, usually on PBS, but to his credit, he published in December 2015 a very large consecutive series of patients he's treated, about 700, with a variety of syndromes, including atherosclerotic heart disease, and great results when you include nuts and seeds. He's not an added oil fan. He's a avocado fan. So because of his influence in data, now all of a sudden in this year, Dr. Dean Ornish's heart disease reversal programs permit added nuts and seeds based on data from the physician's health study, nurse's health study, that you probably are achieving a health benefit by walnuts and Brazil nuts and pecans and almonds and such. Avocados nobody's studied, but I'm a fan of avocados. It still gets to added oil. And I got to say, there's just indecision. Is ApoE going to guide whether you can, the Predimed study, which gets lots of olive oil accolades, really showed a reduction in stroke. It's often said that it showed a reduction in heart disease. It didn't, statistically. All of the benefit in Predimed was due to cerebrovascular benefit. So I'm not as swayed by, a olive oil funded study that did not show cardiovascular benefit, showed, neurologic benefit. I still advise my patients to be cautious about added oil. I'm not a fan of coconut oil, very unpopular stance in 2016, but I can't find any data that suggests that coronary disease is benefited by added coconut oil or medium chain triglyceride preparations. And I have to kind of fall back to a little data on palm oil that suggests it's not favorable. And just a general trend in obesity in the United States. I don't think we're suffering a lack of added oil in American diets. It's one avenue to try and control your weight is to be cautious with the highest density of calorie foods that we are exposed to.
Yeah, no, that's the answer. Yeah, no, fantastic job. Yeah, I love it. Thanks.
Great.
Thank you.
Well, thank you. I'll open up another question here. This looks like the question, let me get to it here, is from Debbie Cardle. Debbie, are you there?
I am, yes. Can you hear me?
Yes.
Yeah, I was just wondering, it seems like that he addressed the question earlier about the change in Dr. Ornish's recommendations to include nuts and seeds in the diet. I was just asking him to comment on that, so I think he already answered the question.
All right, thank you.
Thanks.
Okay, thank you. And then we have a Dr. Amy Doneen that has a question. Amy, can you unmute yourself? Let's see here.
I think I'm unmuted now.
There we
Can you
go.
hear me?
Yes.
Well, hi, Joel. Excellent job. Thank you so much for sharing all of your wisdom with us. We really appreciate it very much.
Thanks, Amy.
It was great. I want to congratulate you on your restaurant. It's fun to see all the change you're creating and the buzz you're getting. You're really doing a great job of changing the whole culture. So congratulations on your restaurant. Really do appreciate that. It's wonderful.
Sure, and if anybody wants advice on what to do with your 401k before you put it in a restaurant, just call me.
Yeah, very good. My question has to deal with the gut microbiome. I was intrigued when you mentioned you were talking about the saturated fats and obviously in the sort of the egg McMuffin study, as you said, the endothelial brachial dilation change was certainly quite obvious at that 4-hour mark. And you went on to say how the saturated fats, processed foods can change the gut microbiome. And I'm just curious, we've been doing a lot of research and thought clinically around the gut microbiome and the idea of measuring haptoglobin, and wondering if you've had the opportunity yet to look at some of the plant-based approach, gluten-free approach with haptoglobin 2 carriers and what your thoughts are in that whole world.
Yeah, I have to say I've not yet been able to activate haptoglobin testing in my clinic. I'm working with my genetics. That's a non-conflicted statement. I don't have any ties to them, so I don't. What I can say is I was the first physician in the state of Michigan to get TMAO testing. And
Right.
I've been like one of the most fascinating, new topics in cardiology in the last few years. More than 1,000 peer-reviewed papers now on TMAO, trimethylamine oxide, believed to be phosphatidylcholine, and carnitine, egg, cheese, meat, fish derived nutrients converted by our microbiome into TMA, trimethylamine, and then converted by an enzyme in our liver, flavine monooxidase 3, to TMAO. And TMAO is now known to prevent reverse cholesterol transport, accelerate bone cell generation, and kind of antegrade cholesterol plaque development. Now known to cause scarring in the kidneys, now known to cause scarring in the heart, felt to be not a biomarker, but an actual pathogenetic factor in cardiovascular and renal disease, may be inhibited by garlic in one animal study, may be inhibited by some of the components of balsamic vinegar in red wine, a product called dimethylbutane in animals. No probiotic has yet prevented its development. So I've probably tested that in about 500 patients, and it's fascinating because it's a reflection of the microbiome.
Sure.
We don't know which bacteria creates it. We don't know which probiotic might inhibit it. But I've had a lot of, supposedly a vegan microbiome in the original Cleveland Clinic studies can't create TMAO, and yet I have vegans in my practice, and I have a varied practice, certainly not just plant-based eaters, that have extremely high levels of TMAO. I've called the Cleveland Clinic, and they have levels of 50 and 100, like these wild, crazy high levels. But they're taking supplements when I go through the whole list, carnitine and choline. I have now a handful that I've stopped their supplements. Their TMAO levels fall nearly to normal. I certainly have a lot of non-plant-based eaters with very high levels, some of them on supplements with carnitine and choline. Some of them seem to be just their diet, and working to try and see if we can improve it, because I don't know any other therapy other than changing their diet and addressing their supplementation. And I think we don't know enough yet to say who's taking carnitine. Generally, a supplement I've been kind of interested in for congestive heart failure and sometimes cholesterol, as you know, like protein A therapy, and some don't bump their TMAO and some do. So thank goodness that assay is available and all. And,
Right.
I think we're really, really early in understanding really, what we can do to assess and manipulate the microbiome to make it more favorable in cardiovascular disease. Is it Lactobacillus reuteri, which has been shown to drop cholesterol? Is it Saccharomyces boulardii, which has been shown to have some benefit in congestive heart failure? I don't know. All I can say is eat less eggs and meat. Let's retest it and see if the number comes down. And I assume that's good for a patient, but I don't know for sure.
Right. No, thank you very much. That's excellent. Thank you.
That's great. And it looks like we have a question from Robert Bailey. Are you still there, Robert? Hopefully we...
Is it Bill Bailey? Because I wonder if Bill Bailey's still home. or is that a song?
He doesn't have a microphone, so let me see if he can. Can you type out a question, and I'd be happy to ask it for you. So we'll see if I get a question from him. We have also Gina Pritchard. Looks like she has something she would like to say. Oh, we actually have a few more questions as well. So let me see. Gina, did you have a question? Well, let's see here.
Can you hear me?
She did. Oh, are you there?
Yes, I'm here. Hello.
Oh, good, great.
I really just wanted to congratulate you. Thank you so much for this excellent presentation. I don't have a burning question, but I would love to have further discussion. Excellent. Thank you for offering this addition to the monthly scientific sessions. I think it's helpful and it's informative, and we need more of these kind of offerings. But Joel, you did a great job leading this off. Excellent. Thank you.
That's great. Well, thanks, Gina. It looks like we have a...
you stimulate me just to say, this is really an interesting story, and I wish we hadn't studied studies of large size, but just don't exist in most nutritional trials. Just in the past few months, for this enzyme, FMO3, flavin monooxidase 3, that converts TMA to TMAO, the active agent that seems to be quite detrimental to cardiovascular health, is augmented by environmental pollutants. So if you happen to be eating in a way that you have more dioxins in your body, whether it's environmental toxins in fish that have been poisoned and other things, you're actually more likely to create this product that injures your heart. It kind of ties a whole bunch of different aspects of root causes, and I don't know that there's an answer to it other than being hyper careful about your diet. Some people call it a qualitarian diet. Pay the extra money for organic, because we live in a world where it's almost non-optional, sadly. But the science is so evolving that I think in the Bale Donine course, this would be nutrition is just exciting, and it has implications. Clean eating can be the overall heading, and how you define that can be your choice, but it's almost non-optional nowadays.
Along those lines, I did get a question from Robert Bailey. He typed in to please have you comment on Dr. Mike Hyman book, Eat Fat, Eat Thin.
Let me just choke a little on that question, because it brings...
Oh, I think we kind of lost the audio there for a minute. Are you still there? I am not able to hear. Oh, it looks like we may have lost Joel's Wi-Fi. his signal strength was pretty low there. So we will see if he might jump back on here in a few minutes. It looks like there are a few more questions that some of you had. If we are not able to get him back on the webinar, then I will pose the questions to him and we can email the answers out to those questions that you had for him. So we'll see if we can't maybe get him back on here in a few minutes. And let me see here. Yeah. I'm thinking it's not looking like we're going to get him back on here. So thank you, everyone, for joining us. And we're really excited about having this opportunity for some of the Bail Doneen supporters to kind of share some of their knowledge in different fields of interest. And we look forward to the next one. And I will be in touch with you to let you know the next guest webinar speaker that we have. And like I said, I have a few questions written here, and I'll make sure that we get the answers to those questions for you from Dr. Kahn as soon as we close this session and we can get that done for you. So thank you very much and have a good night.